So one of the most common questions that I get as a labor and delivery nurse, especially as a labor and delivery nurse on the internet, is what are my options for pain control? What are the risks? What are the benefits? And what should I do? Now, I'm not here to tell you the last part because I want you to make your own informed and empowered decisions. And I want to give you some extra info that you might need in order to make those informed and empowered decisions. So there are 3 main ways that we can help you with your pain in the hospital, right? So these are medicinal ways that we can help you. I'm not talking about like heat, massage. Those are all great. We're just talking strictly about medicine forms that we can give in order to help you with your birthing experience. If you want it. You don't have to have it if you don't want it. You could say, bump all of it. You don't want any, and that is fine too. I will be your cheerleader if you want me to be your cheerleader, and I will be your fairy drug mother if you need me to be. So let's get into it. If you want to know more about labor, birth, things that are available to you, things that you can use, tools, interventions, hit the subscribe button, like button, and then also the bell. If you were someone who has birthed a baby before, what was your plan going into the hospital for pain control? And then what ended up happening? And were you happy with the outcome? Drop it in the comments and we can talk about it. So when you go in to have your baby and you're having like a vaginal birth, that's the plan at least, we're going through labor, you are typically going to have 3 options available to you depending on where you deliver that can help you with your pain. I'm going to put them in order of how well they work, and I'm going to give you the same spiel that I give to all of my patients about these medications. The first option that we have for you is something called nitrous oxide or laughing gas. This may or may not be an option to you depending on where you deliver. Your hospital may not have this, but I put it first because nitrous oxide is not there to take your pain away. It is there to help you relax. And the best thing that you can do going into using nitrous oxide is to understand that fact. Because I have had patients who have really high expectations of the level of pain relief that is going to give them, and they're sorely disappointed. I had a girl one time throw it at me. She said, "That's some bullshit." Great things about nitrous oxide. It works very quickly and gets out of your system very quickly. How does it work? It is a mask that you hold onto your own face and you breathe it in when you want it, and when you don't want it, you take it off. It's got like a mechanism to where it only comes out when you breathe. Take big deep breaths, and when it's not up to your face and you're not sucking on it, it's not like spewing out laughing gas into the room. That might make everybody's experience better, but that's not how it works. I also don't want you to think like dentist level laughing gas stuff. I think I hit that. I don't want you to think like dentist level laughing gas situation. This is a little bit less than that. So good way of thinking about it is that it will make you feel like you are hurting in outer space. So the pain is still very real. The pain is still there, but you're like not there. You are astronaut cadet in the outer space. So if that sounds intriguing to you, this might be a great option for you. Other great things about it, we don't have to worry about it affecting your baby. It has the least effect on your baby of like all the things that we could offer. If you are going into labor and birth and you are hoping to not use other forms of pain control, i.e. an epidural, laughing gas can be a great option because it's something that you can use to be able to cope with pain. Other great things about it, you can use it throughout your labor, throughout your birth, and even after birth if you feel like you need some help, like let's say you tear and they gotta fix your situation down there, make it look tidy and neat. That's unpleasant, but you can use laughing gas if you need it to be able to get through that. So there's no cutoff point where they're like, oh, it's too late that you can't use that. No, you can use it all the time. Our second option of pain relief that works a little bit better than the laughing gas option is IV pain medicine. Now, there's a lot of things to be said about it. The first thing I want you to know is that it doesn't take all of your pain away, right? Laughing gas doesn't take your pain away. IV pain medicine doesn't take all your pain away. That top part of the contraction where you feel like you're going to literally lose your mind, it makes that not as bad. It can make you feel like you had a couple of glasses of wine. You're feeling a little loosey-goosey. And that could be pleasant to you or that could be not pleasant to you. Because it can make you feel loose like a goose, you also may get a little nauseated. And so you can ask for your bartender, aka your nurse, to do a little cocktail of IV pain medicine and then also give you some nausea medicine too. That's a pro tip. Throughout your labor, you're probably going to throw up at some point. Labor makes you throw up, unfortunately. But sometimes barfing helps you push out your baby, helps you get your baby down there. Here's what you need to know about IV pain medicine though. Because we are giving it into your bloodstream, some of that goes to your baby. And because some of it goes to your baby, we will never give it to you if we believe it to be unsafe. There's a couple times where it would be unsafe to give you IV pain medicine. The first is if your baby on the monitor is looking what I call sleepy. There are fancier ways to describe it, but if your baby's heart rate looks really flat on the monitor instead of looking beautiful and like, that would be a time that I would want your baby to wake up a little bit more before I would feel safe giving you some of that medicine. Some of it does go to your baby and can make your baby even sleepier. Another time we don't want to give it is right before your baby is born, because if some of it goes to your baby, it can make your baby too sleepy to reciprocate my love when they come out and they go from being an indoor cat to an outdoor cat. And they can be too sleepy to want to do things like breathe. And that is important. That is an important part of being an outdoor cat. You must breathe. Some hospitals are going to have different cutoffs. Where I work, if you're like 8 centimeters, I'm so sorry. And I've had this conversation so many times. I'm so sorry. I cannot give you it because it would be unsafe for me to do so. But let's say you've been 8 centimeters for 6 hours. That might be a different story. But typically, if you're going fast or we reach that 8 centimeter mark, they're going to say, so sorry, Bobo, you cannot have the IV pain medicine. Next thing I want you to know about IV pain medicine. A lot of people don't know that the most common drug that we give in labor, IV pain medicine style, is a medicine called fentanyl. What? You giving us fentanyl in the hospital when we're pregnant? That is wild. Can't have a Jimmy John's sub, but you're going to give me some fentanyl? Yeah, I know. It's crazy. But you want to know why? A couple things. Number one, we're not getting it from Larry down the street. I promise. He is not my supplier. I don't get it from him. We use it in the way that it was intended to be used, in the dosage that it was intended to be used. It works quickly and gets out of your system fairly quickly. So like within an hour or so, the effects of it have kind of worn off. So it's a way that we can get really good pain control quickly, works within just a couple minutes. There are other medicines available to you that you may think sound like a better idea because maybe you haven't heard of it in a negative way like you have fentanyl, but there are reasons that not a lot of people use those other medicines, like they have a very similar effect, but they last for a lot longer. So your doctor may want to give you fentanyl instead, but it's just important that you talk to your doctor or your midwife about your options for pain control when it comes to that IV pain medicine, and you can feel good about whatever decision that you make. Also about the IV pain medicine, I want you to remember that the more we give it, the less it works. And that's for 2 different reasons. Number one, your labor is progressing. So where you had pain earlier, now your pain is getting ramped up. It's getting more serious. And then the other reason is that your body can kind of get used to the medicine a little bit and need a little bit more in order for you to feel that same effect that you had before. I hear a lot of people get really nervous about using these hardcore drugs that you never even thought you were going to use in your life during labor. Now, the risk of getting addicted to something like IV pain medicine in labor is so rare. You are more likely to get addicted to opiate medications if you go home and are taking lots of Percocet or Vicodin after your baby is born in the postpartum time. It's not to say that you shouldn't take those things when you're hurting, but more addiction comes from pills than having that IV pain medicine when you really need it in labor. It's not to say that it can't happen. I've never seen it happen from IV pain medicine. It's possible because I'm not following up with everybody. But I don't want that to be a really scary thing for you. Now, if you are somebody who has struggled with addiction, it is perfectly reasonable to say, you know what? I really am not interested in receiving IV pain medicine during my labor. I will support you. Amen. Hallelujah. Oh my God. Why is this happening? I've never been addicted to IV drugs. However, I wouldn't want to go back to that life if I had gotten better at that point. With IV pain medicine, I told you it kind of makes you feel like you've had a couple glasses of wine. And I told you that with nitrous, you feel relaxed. So think relaxed plus the couple glasses of wine, the woozy, the relaxed and woozy is kind of how you'll feel. My biggest advice if you do receive IV pain medicine in labor is to ride it like a wave. If you get it and you don't like the way it makes you feel, that's fine, but you're going to feel it for the next hour. So if you begin to freak out, like, I don't like this, you're going to have straight up a not good time. So I'm going to talk to you as somebody who's maybe just eaten an edible and they don't like it. We're going to relax. Because if you don't like the way it makes you feel, you're only going to perpetuate that feeling. Get in a cozy position in the bed. Put that pillow right up against your neck. If you've got a soft blankie, put it right up next to you and just melt. I want you to melt into the bed. Do not think about the next contraction. Do not think about the pain. Just ride the wave of the medicine and allow it to take you on a journey. It's not really, I'm acting like this is an edible experience. It's not. It just helps you to relax. It helps that pain to go away. I haven't had too many people that are like, I hate the way this makes me feel. But if that does happen to you, I want you to have some coping mechanisms that you can use, i.e. melt. Imagine melting into the bed. That will kind of help you to ride that wave till it wears off. The last medicinal way that we can help you with your pain is something called an epidural. You've probably heard of it before. Most people in the United States get an epidural. An epidural is basically like an IV, but in your back. An epidural is a flexible catheter that is left in your back and taped to your back so it doesn't fall out. But it goes into the epidural space. What is the epidural space? That's crazy. I don't know what that is. This is your spinal cord. Around your spinal cord is the intrathecal space. That's where they would put medicine if you were going to have a C-section. Keep thinking this is the spinal cord in the middle, but I'm going to use my other hand. Surrounding the intrathecal space is another space called the epidural space. So the thing about an epidural, it goes below the level of your spinal cord. So your spinal cord goes all the way down, and it comes to a point. The epidural goes below that and goes not into the space where the spinal cord even would be, but the space outside of that space. That epidural space, they thread that catheter and they give you continuous medicine that is going to help numb you from about below your boobies down. What that feels like can be when you sit on the toilet for too long, you're taking a big fat dump, your legs get a little tingly. Kind of feels like that. I've had many people say, oh my gosh, I'm going to freak out. Like, that's a terrible feeling. When you compare it to the pain of childbirth, it's very minor. But that can be a reason that people don't want it. Is like, oh, I don't want to feel numb. Valid. There is a button that you can press if you are still having pain. Now, pressing that button a bunch, because I've had patients like this that are like, oh, I'm afraid to feel anything. I'm just going to keep pressing it. You're going to find some trouble. A couple things that can happen. You can get what I call a Lieutenant Dan epidural, where you ain't got no legs. You can look at your legs and you can tell them, leg, move. And your leg says, no, I ain't got no legs. Whose legs are these? They're not mine. Another thing that can happen is that you can give yourself so much medicine into that space that you begin to get like a neck ache or like a backache way up top. And that's just from having too much medicine in that space. So only use that button when you need it. Epidurals do not take the pressure that you need to feel in order to push your baby out effectively. It doesn't take pressure away. So if you have a great working epidural and you don't feel any contraction pain anymore, and then all of a sudden you feel a lot of pressure, that is very normal. In fact, we want that because the sacral nerves, aka the nerves in your butt, are much thicker and the epidural juice does not coat them as well. It doesn't mean that anything is wrong. Caveat, I once had a patient who came in who said, I do not want an epidural this time because last time my epidural worked great until it didn't, okay? It stopped working, right? So she said, last time epidural did not work. whenever it came time to push the baby out. Now, in my mind, as a nurse, I know what that probably means is that she said that it worked great. Epidurals rarely wear off at the end, but it feels like it. Do you want to know why it feels like it? I already told you. Those sacral nerves are thicker. So you can experience intense pain and pressure in your butt when the baby comes out, and it can lead you to think, oh my gosh, my epidural doesn't work anymore. Now, it's not necessarily that. The only times that your epidural stops working is if it gets pulled out or turned off. So what happened with this girl is that we went through an unmedicated labor together, and she was pushing out her baby. And instead of saying like, yeah, like doing the big, she's pushing, she's screaming and saying, my epidural did work last time. Know that even if you have an epidural, it does not take every sensation away. So kind of like having good expectations with what nitrous oxide and IV pain medicine can give you and how that might feel, it's good to go into an epidural knowing that it's not going to take all the sensations away that are unpleasant. It can take them down by about 80%, but then you can come to a point where you're like, uh-oh, something's happening. But we like that because we don't have babies born in the bed, right? You having some sensation can help you to be able to push your baby out. Let's talk about risks of an epidural. Anytime you go through the skin, there's always going to be a risk of bleeding, and there's always going to be a risk of infection. We minimize that risk of bleeding by checking something called a platelet count before we stick you. And your platelets are kind of like your helpers of clotting. Epidurals are a sterile procedure, right? So we use sterile gloves, anesthesia team. They use cleaning solution to clean off your back. Everything's in a clean situation. So those are the way that we try to mitigate those risks. But those are always risks anytime you go through the skin. Things like nerve damage or having severe nerve something happening are lower than your risk of getting into a commercial plane crash in the United States. The risk is there. Could it happen? For sure. However, that risk is very, very rare. The most common side effect from an epidural is a drop in your blood pressure after it is put in. And that usually happens within the first 30 minutes after your epidural. So if you have had an epidural and all of a sudden people start running into your room and start turning you and stuff, it's likely because you had a drop in your blood pressure. Sometimes it can make you feel woozy. Sometimes it can make you feel nauseous. But a lot of times it can make your baby say, what the heck just happened? But it's very common. And your nurse should be sitting with you right after that epidural. At least that's policy where I work. We sit with you for 30 minutes to make sure that you are with your blood pressure. Now, the reason that happens is because when you have an epidural, your whole body relaxes, including your blood vessels. Now, we mitigate that risk of dropping your blood pressure by giving you a fluid bolus, aka IV fluid, in a concentrated way before you get your epidural so that we prevent that from happening. Does it still happen? For sure. But if it does happen, you may see things happening quickly. Doesn't mean that we're freaked out by it. Happens all the time. The best kind of epidural is one that takes away your contraction pain in your belly, but still leaves some movement in your legs. You should still be being turned a lot, at least once an hour after you get an epidural, because motion is lotion in labor, and your nurse should be turning you like a rotisserie chicken. If they are not, you call out and you say, hey, can you help me change positions? And then they will come in and they will help you. I say best time to get an epidural is when you can't do it anymore. Sometimes you can come into the hospital at 10 centimeters dilated. We say, I'm so sorry, it's too late. But if you're in the hospital throughout your labor, rarely are you in a situation where they say it's too late. Can happen if it's a first time person having a baby. Very, very rare for us to say, oh, it's too late. Another myth is that if you're 10 centimeters dilated, you can't get an epidural. I've done it. It's more important that we're saying you can't get it if you're going too fast, right? I've had people who came in 2 centimeters dilated and couldn't get an epidural because they went from 2 to 10 in 15 minutes. That is more likely to be a situation where they say, oh, you can't get an epidural. But just recently, I had somebody who was completely dilated for 3 hours, and we ended up getting an epidural after that 3-hour mark. So it's less about how dilated you are right now, but more about how fast you're going. Another common myth about epidurals is that it's going to give you chronic back pain. Now, they've done studies on both people who have had epidurals and people who have gone unmedicated, no epidural, and they found that the rates of chronic back pain were the same. Now you'll probably say, what the heck? I got an epidural and my back hurts, so what's up with that? Yes, the common denominator between all of the people who have back pain is pregnancy. When you get pregnant and your body begins to change, you start out regular, right? And then as your belly grows, your butt sways out and your belly goes forward. So your body changes in such a way that it permanently alters the way your skeleton is. Your muscles, your tendons, your bones, your ligaments, all of those things change, and that can cause chronic back pain. The thing with an epidural is saying that like, oh, it hurts where I got my epidural is kind of like saying where they put my IV still hurts. I am not doubting that you have pain there. I'm just telling you that most likely it is from the changes that occurred during pregnancy and the birth experience. There are also studies that were done that said like the rates of chronic back pain were even slightly increased in the people who didn't have epidurals. So I don't want that to be a reason that you decide not to get one if it's something that you really wanted, because it's a little bit of a myth. You can get mad at me in the comments. I'm so sorry to be the bearer of bad news. Also, with an epidural, it alters the way your brain communicates with your bladder. So when you get an epidural, you'll be catheterized in some way, usually where you can either do an intermittent catheter where they put a little tube into your pee-pee hole to drain your bladder and then bring it right back out. Or you can have something called a Foley catheter, which is where they put catheter in and then they inflate a little balloon inside your bladder so it doesn't come out. And then that can continuously drain your bladder. Now, the reason that you want to make sure that your bladder stays nice and empty during your labor progress with an epidural is because, number one, your brain cannot tell your bladder to pee anymore. And then also a full bladder or a bladder that keeps urine in it or that can't empty all the way can increase your length of your labor because your uterus can't get down in where you need to push out your baby. And then also it can put you at risk for hemorrhage for the same reason that your uterus can't clamp down and stop itself from bleeding after your baby is born. Great things about catheters during your epidural experience is you can't feel them. Rarely ever can you feel them. And if you can also press your little button if it's bothering you. But anyways, I hope that this conversation has been helpful. I hope that you can go into your labor and birth experience and know a little bit more about what is available to you medicine-wise to help you. And maybe in another video, I'll talk to you about non-medicinal ways that we can help your labor pains. Now, why does it keep doing that? I don't know, man. I really don't know. I don't know if it's a good thing or bad thing that it keeps popping up. There is a gnat here, and I want to be able to get it. Anyways, you can be Space Cadet. You can be Cadet Kelly in space. Do you remember that movie? That's a good movie. Sorry, I'm so gassy. When y'all are watching this, you're gonna say, man, that girl's gassy. There's a gnat. I don't know. Y'all probably see it. Tell me where it is. Not that you can. What was I saying? So, there's a gnat. There's a gnat. I wish I could catch that gnat. Yeah, I shouldn't talk about drugs that I've done. I haven't done many drugs. I've only tried an edible once. Well, twice. Keep that a secret. Don't put that in the video. What's that? Hold on, my mom's calling me. What was I saying? Oh, I'm so sorry. Oh, right, like, wait. So, finally. Oh my gosh! Epidurals! There's a gnat in here. No, that was a piece of hair. Sorry. Getting into a... There's a gnat. There's a gnat. I'm going to kill it, but I don't know where it is. I really hope you can't see it flying around this room. More power to you. I'm going to be your cheerleader all the way, if that's what you want to do. I'm not. I'm going to be hating outside the club. I'm not hating anything. I'm hating the pain. Don't say that. Hold on. Where was I going with that? Hit that like button. Hit the follow button. No, not follow. Subscribe.